Today, we're continuing our discussion about metabolic dysfunction associated steatotic liver disease, or MASLD. Remember, it exists on a spectrum from MASLD to MASH or steatohepatitis to advanced chronic liver disease, which of course is what we're trying to prevent. If you haven't already watched the videos about screening for MASLD, I recommend you start there so that you can use those tools as you're starting to manage patients that have MASLD. As usual, we'll start with a case. 37-year-old female coming in for routine follow-up. She has a history of prediabetes, dyslipidemia, obesity, and MASLD. You have recent labs from her. Her platelets are 145, AST is 31, and her ALT is 32. We get those because it's really important to calculate the FIB4, not just monitoring transaminitis. When we plug this into the calculator, we get a FIB4 of 1.4. Because it's over 1.3, this puts us in the indeterminate range, so it's really important to follow these patients closely because there's a chance they could develop advanced chronic liver disease. We appropriately send this patient for transient elastography, and the report comes back that she's got stage F2 fibrosis. So what do we do? Classic teaching for these patients is to reach for either vitamin E if they do not have type 2 diabetes, or pioglitazone if they do have type 2 diabetes. But really, this is for biopsy-proven NASH and not necessarily for the patients that we're seeing in clinical practice. There are weak recommendations from both the American and European guidelines for vitamin E and pioglitazone, but I don't see them much in practice. Really, the bulk of our patients are going to benefit from lifestyle counseling. It's debatable exactly how much weight you want to encourage your patients to try to lose. The American guidelines might say 3 to 5%, although up to 10% if it's an advanced stage. And then the European guidelines are also saying 7 to 10%. And we're really pushing the Mediterranean diet with our patients. I'll link to a similar handout to what I put in a previous video about how I explain that to my patients, basically just breaking it down to the basic food groups: legumes, nuts, whole grains, fruits, and veggies. In addition to the dietary interventions, we're really pushing for physical activity. Ideally, not just the 150 minutes that we recommend to all of our patients, but 150 up to 300 minutes a week. If they're able to get vigorous physical activity, 75 to 150 might suffice. Aside from vitamin E and pioglitazone, you will see lots of medications mentioned when it comes to managing MASLD. Currently, the only approved medication that we have for this is resmetirom, which I haven't seen personally in clinical practice, probably something mostly managed by hepatologists, again, at this point, focusing on diet and exercise. Other medications you'll see discussed a lot include metformin, the GLP-1s, orlistat, statins, caffeine, and other novel agents. On the slide on the screen here, the plus and minus kind of refers to where it falls in terms of treating metabolic dysfunction-associated steatotic liver disease. Metformin hasn't been shown to be effective, although it can be helpful with the metabolic parameters. There is some promising evidence for GLP-1s, although it's not approved. So as I've said in previous videos, I'll use it if there's an indicated use, such as weight loss, but not specifically for MASLD. Orlistat has some mixed data, but it's a really difficult medication to tolerate, so I don't see that used in practice very much, and I've never started it. Statins aren't helpful for MASLD per se, but they can really help with dyslipidemia. And so we frequently use them in our patients with MASLD. You'll hear a lot of patients asking you if coffee is bad for their liver, and there's actually some studies that say it may help with MASLD resolution. Definitely a signal. It's not that I'm telling patients to go drink lots of coffee, but if they ask you if they should be avoiding it, you definitely don't have to say no. And there's other novel agents, so I'm really excited to see what comes up in the next few years in the pipeline, but nothing approved yet. So stay tuned. The most important thing to remember is managing all the comorbidities that we do see with MASLD, many of which do have pharmacotherapy, such as GLP-1s for obesity, statins for dyslipidemia. So I'd love to hear how you're treating MASLD in your practice. Comment with something that I haven't mentioned so far, something that a pearl that you've gleaned in practice, or another high yield intervention that you use when you're managing your patients with MASLD. As we wrap up, remember that lifestyle interventions are key for our patients with MASLD. Consider pharmacotherapy known to treat the comorbidities, like I mentioned, statin, GLP-1s, and stay on top of the guidelines. There may be more medications approved in the future that might be helping your patients.